Welcome to my podcast. So today I'm going to talk about another case, which is very important in lab 2 examination. So basically, after you introduce yourself, double check the patient name and date of birth. You'll ask the patient, "How can I help you today? What brought you to the surgery?" So the patient might say, like, "I'm having a tummy pain. I'm having discomfort. I'm having like chest pain." So you'll ask him to tell you more about it. So the patient might say, "I'm having like a burning sensation." I might say that I feel like an acid in my stomach. I feel like something just pull or cause me great discomfort. You could have asked um, what triggers this sensation, anything improve it. So the patient might say, when I eat some food, spicy like, or when I eat fried food, or I eat late night, or this kind of stuff. So the patient might say also, I burp, sometimes some fluid comes out of my mouth, and I try to swallow it, and it's really bitter, has great discomfort. So you will tell how long you've been having this. Do you recall anything has caused this at the first place? Is it a new thing? Is it something that you have seen the GP for before? So the patient might say yes or no, depending to the patient answer. The patient might say they bought the OTC Rini or Gaviscon, and they might say it didn't help. So the patient will say, for instance, if he had any vomiting at all, if he had any chest pain, you will explore more. If the patient have any sort of tummy pain, you need to explore more in order to figure out what's differential it could fall under. And then you need to ask about the bowel habit. For instance, if the patient noticed any change in the bowel habit recently, if he had any loss of weight, for instance, because of that might be signposting something serious. You will ask about the stool color, if there is any blood at all. You'll ask if there is loss of appetite, if the patient feels tired, if you had any, if the patient say maybe I'm having like chest pain, and then you explore it more, you will need to ask if there is any shortness of breath, if there is any associated cough, any of that. So then, after exploring all of this, you will ask if there is any, for instance, bad breath or bloating, feeling sick, and you'll just think about what's the most common causes of heartburn in order to ask them. So you need to ask about the risk factor. So, for instance, if the patient is a smoker, or if the lady is pregnant. You will ask about the work situation, if the patient is stressful, having too much anxiety. You will ask the patient if he's drinking too much coffee, for instance. Also, tomatoes well known for causing those kind of sensation, as well as the chocolate and a fatty meal. You will ask about the drinking, if they are drinking alcohol. So all of that will cause this problem. Also, if the patient feels this sensation goes up, so you need to think about Hayat's hernia. And apart from that, you will ask if the patient taking chronic pain killer, like for chronic pain. So it could be NCT, non-steroidal anti-inflammatory drugs like ibuprofen. So this is well known to cause basically heartburn. So after all of that, you need just to ask the patient that if he's happy to be examined. So basically, most of those cases, by the way, they are telephone consultations. So if the patient, because I remember my case was a telephone one. So if it's a telephone one, you will say, it's according to your judgment if you feel that the patient need to be examined. So you will fix an appointment for the patient to be seen. And if you feel there's no need of that and there isn't any sign could point to something serious or sinister, just you need to advise that the patient should eat a smaller amount and frequently, and should raise their head by a pillow. 10 to 20 centimeter in order for the gallot to be at higher level, so the acid won't go to the lower part of the esophagus. And also you will assess the patient body mass index. So if the patient is overweight, you will encourage about losing weight, and also avoid those foods which cause the heartburn, like for instance too much caffeine, fried food, fatty meal, alcohol, smoking. All of that should be avoided. And ask the patient if he's kind of, because certain situation patient, they might wear too much tight clothing, especially around their waist. You will encourage to loosen that. And if they are taking any OTC medication, you will ask them to refrain from that and just take what's prescribed by their GPs. You will then ask them if, if there is anything in particular they are thinking of, if they have any thoughts about anything. Maybe they have their own thoughts about the cause, or they have certain situation where they think it could trigger all of that. And after then, you will ask them if they are happy to be prescribed a proton pump inhibitor, like omeprazole or lansoprazole, for 4 or 8 weeks, just and to improve, and relieve those symptoms. And also ask them if they didn't feel any better, or their situation felt like it's worsened, or it's not improving. So you need to ask them to come back to you, or go to the A&E if there is, like for instance, too much vomiting, if they notice any blood, if there is anything doesn't seem right. If the case has shown from the history that there is obviously something that you need to explore more, investigate more, so you will just say this is a gastroesophageal reflux disease which needs to be explored more. So you will arrange for them for either barium swallow, or which nowadays they don't do that too much. They will send for gastroscope. So you'll tell them that there is a small camera tube which will be used to go through your mouth in order just to check what's going on in the gullet, and from there we can take it. So that's basically in short about those kind of cases, and how to explore them and manage them, of course, with the patient agreement. Thank you.